Welcome to Michigan Reimagined, presented by Good Marketing and Wagoner Financial. And here's your host, Chris Buck.
So healthcare is a hotly discussed topic, and the health and wellness of our citizens drives our ability to be a vibrant community. The Lansing Area AIDS Network is a local nonprofit with a mission to serve residents in a variety of ways. Here to discuss that mission and to share some information is the Executive Director, Kristina Schmidgall. Welcome to the show, Kristina.
Thanks so much for having me.
Absolutely. So kind of when and why was the Lansing Area AIDS Network founded?
So it was started in 1985, so we're celebrating our 40th anniversary.
Hey, okay.
And there were some local individuals that saw the response and wanted to respond to the HIV epidemic that was happening in Lansing. So they started an organization called Lansing Area AIDS Network that was volunteer-based to just help with the epidemic and to help people in Lansing. Over the 40 years, we've grown. We have a staff of 16 people.
Wow.
We get federal funding through the state, and we have a budget of $1.5 million to serve. And we serve a wider than just Lansing, but we serve the 6-county area. So Clinton, Eaton, Ingham, Gratiot, Mount Calm, and Shiawassee counties.
Got it. Okay. And I was just going to ask, is that, are you part of like a larger statewide or even nationwide network, or are you your own individual, but you have tangential communication with other people that are sharing the same type of mission?
Yes. We're part of a statewide. We all are funded through the Michigan Department of Health and Human Services.
Makes sense.
And so every county in Michigan where anyone lives, they would be covered with services. But then those organizations talk to one another. And I'm assuming that happens, with other states. We don't necessarily talk to other states as much. But similarly, wherever you go, there are HIV services.
Right. Makes a lot of sense. So now your space is brick and mortar. You have a front door and a place where people can go, or is this all kind of out in the field type of support that you provide?
We do have an office. We're in South Lansing.
Okay.
And we are in a spot that's on 2 bus lines and is easy to get to us. And I would say probably about 80% of our clients are Ingham County residents. So we want to be in an accessible space for them. But like I said, we serve those 6 counties, so we can go to clients as well. But a lot of times the clients are coming to us.
Got it. So can you talk a little bit about the breadth and depth of the service that you provide? Because I don't want listeners to think, I don't have HIV, I'm not dealing with AIDS, so I don't really even need to tune in.
Yes.
But there's a lot of prevention and education, and share more about what you do.
So we also have HIV, like prevention and education services, and we serve about 300 clients. So we do HIV testing, but in addition to HIV testing, we also do hepatitis C, syphilis, gonorrhea, chlamydia, and trichomonas testing. So you can get more than just an HIV test, but we do testing in the office, and then we go to community events such as Lansing Pride, but then and other Pride events, and then other community events to do testing. And then we also do testing with different partners, different agencies and organizations as well. And that's one of the things that we do. We also have care services, so people who do know their HIV status and need assistance. The goal is to get people to where their HIV is undetectable so that they're untransmittable. And that would helps them, it helps the community, and helps, slow the spread of HIV, but it also helps an individual. If the virus is well suppressed in their body, they can live a healthy, long life. And so we want to do that. So we don't have the clinical medical services at our office, but we assist with helping people get appointments, insurance. We have a food pantry. We help with transportation, whatever they need, housing, employment assistance, trying to help people. Those are kind of wraparound services so that they are able to go to their medical appointments and take their medication.
Wow. Okay. So there's a lot to unpack there. Are those partners that help you with those different supports, or do you do that internally? You mentioned the food pantry, which I definitely want to talk about. But you talk about transportation. I know like the Davies Project is a transportation provider for people. Like, are you talking about partnering with people like that, or do you have your own services?
We have our own services.
Okay.
We purchase bus cards. We help people get connected to Spectran, those kinds of services. We have HOPWA, which is Housing Opportunities for Persons with AIDS, which is funding for housing and utility assistance. And we don't do the housing ourselves, but we assist people in finding housing and then helping them pay for that. So a lot of our things are in-house, but then, how do we work with with partners, and we are big collaborators with different organizations.
Of course.
So if there's services that other people can provide, we definitely are making referrals.
Okay.
And then our other, one of our other big programs is our behavioral health program. And so that's for people living with HIV, but it's also for the wider LGBTQIA plus community. So someone does not have to be living with HIV. So I think, often, like you mentioned, people talk about like, oh, I don't have HIV, but there's services kind of on the front end of education and prevention, but then also behavioral health services. So that we kind of are trying to think about how do we make our agency kind of more status neutral, and that there's a variety of services that would make sense for others in the community.
That makes a lot of sense to me. That's fantastic. I want to give a nod to our friends at Wagoner Financial. Whether you're just starting out planning for retirement or anywhere in between, Wagoner is here to help you make smart financial decisions. They offer comprehensive, customized planning from investment strategies and tax solutions to insurance, accounting, and estate planning. Wagoner is dedicated to supporting you, your family, your business, and your future. Using their unique team approach, their team members' specializations ensure that you have someone who will have an answer to your question and is ready to help. Schedule a consultation by visiting wagoner-financial.com or call them at 517-853-3367. So in preparation for this, I went on your website and like to just kind of scour around, and I was really taken by the outreach and the kind of the numbers, the
Yes.
amount of people you serve and some of the things so talk about your reporting and how wide is your reach and what type of clientele do you serve on a regular basis?
Yeah. So with our HIV testing, we serve about 300 people a year. And then with our case management services, we serve about 200 a year. And then with our behavioral health, we're serving probably between 50 and 75 individuals a year. And like I mentioned, we serve that 6-county region.
Yeah.
And so, just a wide variety of services. Our services for our medical case management program have eligibility requirements, but people are always welcome to contact us, and if they're looking for services, and we can also help connect,
right,
if we're not able to serve them.
Okay, got it. And so you mentioned also the food pantry.
Yes.
So important. I thought that was an interesting fusion of two desperately needed services. Obviously, the AIDS Foundation, but then also the food pantry. How did that start, and why is that so impactful?
Yeah, well, one of the reasons that we started the food pantry years ago was because we wanted to make sure that the items that people were getting from food banks were not expired, and that we were able to also give, in addition to like canned and boxed items, we were able to give fresh items. So we've had a variety of partners over the year. Currently, we're working with Greater Lansing Food Bank and then also Food Rescue. And both organizations were able to get food. Sometimes with the Greater Lansing Food Bank, we purchase food. With the Food Rescue, they go and get food and rescue that actually from the Okemos Target and bring that to us. And we get produce and eggs and sometimes a random Halloween costume. But we get items that we're able to give to our clients. And then our clients are able to go through the pantry. And we also serve there's other organizations in our building that we've partnered with, and we will work with them, such as Punks with Lunch, Lansing Syringe Access, so that their clients can also use food resources. We're not able to serve all of South Lansing with our food bank, and sometimes people will hear about us. But if people come to the door and they're hungry, we're not going to turn anyone away. Yep. But then we might say, hey, we're going to give you some food, but here are some food banks that are just serving South Lansing that you might want to make yourself aware of.
Right. Okay. That makes sense. So you mentioned that you're under the Department of Health and Human Services, and it sounds like they're a primary funding mechanism. But how else are you funded and governed? And do you have kind of corporate sponsorships, volunteers, individual donations? Do you have events that help raise money to help you meet your budget? Talk a little bit about the infrastructure.
Yes, we also get funding from foundations. So the Capital Region Community Foundation has been a funder for us. Michigan Health Endowment Fund has been a funder for us as well. And then, yes, we have donations. People give to us. We have fundraisers. We have our annual AIDS Walk. We recently did a fundraising event for our 40th anniversary. And then we just have individuals that, enjoy what we're doing in the community and are, generous towards us and will give to us. On our website, people can give. There's like a donate button. People can give on a monthly basis, or they can give, a one-time gift. We do an end-of-year appeal. We do, the typical things that nonprofits do.
Got it. Okay. And so you talked about a couple of the events that you have. And so while we were recording this in September of 2025, people can find this show at any time. So
Yes.
talk a little bit about maybe some of the rhythmic things. You talked about AIDS Walk.
Yes.
When does that typically tend to happen?
We typically have our AIDS Walk in the fall, but we've decided for this year to move it to the spring.
Okay.
We just wanted to be able to do it in a better fashion, and so we have moved that to the spring. One of the things we noticed is that over the summer, we go to a lot of festivals, a lot of community events, and that by the time we get to the fall, we're just tired. We've been going and doing. And so we thought about, what if we put the walk at the beginning of the season? And so we are looking to put it in April this next year and trying to say, what would that look like? And that is one of our biggest fundraisers. But it's also a time for us to have community awareness and to bring individuals out and to say, HIV is still here. I think sometimes we talk to individuals and they're like, oh, HIV is still around. And we're like, yes, it's still around. It still impacts the community. It doesn't get the headlines that it once did, but it is still around and still impacting. And we still make a difference.
No question. And I actually had that question, and I was trying to figure out the best way to ask that, because I don't want to sound insensitive, but as a child of the 80s, it was omnipresent. Obviously,
Yes.
Crashed onto the scene. It was an epidemic. I think maybe literally, but it, certainly, like you said, the headlines have softened, and I wasn't sure if that was because it was old news and didn't make the press, or whether it has been controlled enough that it doesn't need to be completely in the forefront, but make sure that there are services, because it absolutely is still out there.
Absolutely. And I think that comes from a couple of different situations, but I think one of the reasons is that people aren't dying of HIV in this country in the way that they were in those early years.
Okay.
We have medication, and so that makes such a difference for people's lives, for the quality and quantity of their life. And now when we have clients pass away, they're typically older adults, and they have been in a nursing home for a while, and people are passing away from the same things that other people are passing away from. So I think that's one of that. And then also people are just becoming older with HIV. And so it's just not on the radar. I also think that it's become a disease that's more impacting of marginalized communities.
Okay.
And so that's not something that's hitting the media and the news in quite the same way.
Right. Seems more like quoting one of my favorite shows, Rent, to live with and not die from.
Yes.
Disease. So.
Yes. And we're really trying to help people do that. I mean, we have like a group of older clients, and that's not something that you would have thought in the early days that people would have gotten older. So now one of the things we, are helping them with are like other comorbidities and other diseases and how to manage. And sometimes their HIV is very well controlled. It's everything else kind of going on medically or other aspects of their life that we're really assisting with.
Right on. Well, I want to thank our friends at the Kirk Byron State Farm Insurance Agencies. Today's podcast is sponsored by our good friends at the Kirk Byron State Farm Agency. Their mission is to put the customer first when helping them plan for the risks of everyday life, to prepare for the unexpected, and to realize their financial goals. Kirk and his team build value and confidence in your auto, home, life, health, business insurance, financial service needs. Kirk is always looking for opportunities to help customers in mid-Michigan and around the country. Everyone has insurance needs, and you do well by contacting Kirk Byron State Farm Agency to hear what these experts have to say. You can get in touch with them by calling 517-349-3830 or look them up at sfbyrons, that's BYRENS.com. You will not regret it. So, you've talked about the services that you provide in the community that you really try to penetrate. If I'm a listener, what is your message to the listeners? When should they reach out to you? How should they reach out to you? Like, what is your call to action for maybe an audience that isn't terribly familiar with your work?
Yeah, I would suggest starting with, have you ever had an HIV test? If you're unsure, definitely can contact us. We can make an appointment. And the test is a 20-minute test from starting to getting results. And it's a small finger prick, similar if someone with diabetes is checking their blood sugar. So it's not like a significant blood draw. It's not going to be something that's terribly invasive, but also to talk to people about their risk and how to reduce risk. But people sometimes assume, I'm sure my doctor is testing me, or I'm sure this is happening. Well, asking those questions and knowing your status and knowing like how often you should be testing based on risk. But then also knowing like, okay, do I get tested for other STIs? And we can do that testing as well. So I think that's kind of the start. And then, if someone is living with HIV, like, are they needing extra services? Are they needing any assistance? something, for instance, insurance can be very complicated and very difficult to understand. And we've got people that can assist and trying to figure out, does someone have adequate insurance? Is it covering all your specialists? Is it covering your medications? And then also with our mental health program, are you needing to talk with someone about what's going on? Whether it's anxiety and depression or more that's happening in their lives, and we're really trying to serve the queer community in that, and just letting people be themselves when they come to us and speak about their lives.
Got it. And if people are touched by the mission but maybe don't have an overt need, you said that they smash that donate button on your website. What is your website? We are at
lanonline.org, and LAN is LAAN. Lansing Area AIDS Network. It's LAN, like rhyming with flan.
Yeah.
So often people want to call it LAN, like pan, but it's LAN.
Right. LAAN, online.org. .org.
Yes.
Perfect. And the opportunities to donate there. And then do you need volunteers outside of just the events? I mean, are there people that can kind of show up and supplement your team?
Yes.
By just donating their services?
Yes, we definitely need volunteers for our events, AIDS Walk, and when we are out doing community events. But yes, we have the opportunity for people to sit at our front desk and greet our clients and our visitors that come. We have the opportunity to do like condom packing partners. We give out a lot of condoms to the community for risk prevention, and we have to put those together, and we put some information in there as well. So that's a way that people can volunteer. And also then with our food pantry, helping our clients go through. It's set up in a way that there's shelves and refrigerators and freezers so that it's almost like a shopping experience for individuals. So someone to walk through and to just talk to individuals and make sure that they know what's there. We just got this item. Are you interested in this? Do you want to take that Halloween costume that's been lingering for months on the shelf?
Funny.
But yeah, yes, we definitely have an opportunity for volunteers. And, we started as a volunteer organization, so our volunteers are very critical for us.
Got it. Wonderful. What have I missed? Is there anything else that you'd like to let our listeners know that I haven't brought up?
Well, I will say going to our website is a way to contact us. We have, a contact us button, and then people can just do that. And there's a way to click and say what they're interested in talking to us about. So if they are in need of services or volunteering, that we can do that. And I will just mention that we try to be very collaborative with our agency. There's a lot of organizations in Lansing that we are working with and trying to partner with. And I'm always willing to talk with anyone about how we can collaborate and how our services can come together. Or if anyone's interested in hearing more about the organization, I'm always willing to talk with anyone about that.
Fantastic. Well, great information.
Thank you.
Honestly, I was so excited to stumble on your mission and have you on the show to really let the community know what it is you're up to. It seems like a very important work that you're doing right now.
Thank you so much for having me today.
Absolutely. So we've been speaking with the Executive Director of the Lansing Area AIDS Network, Kristina Schmidgall, and it's LAANonline.org.
Correct.
If you want to go in and learn more, ask for assistance, offer to volunteer, and certainly you can go ahead and donate.
Thank you.
Wonderful. Thanks for coming in today. And I'd love to give a final shout out to all my loyal sponsors. We've got Wagoner Financial, Good Marketing, Triterra Environmental, Keller Williams Advantage and Team, Michigan Rise, Kirk Byron State Farm, and the attorneys at Foster Swift. These are all fantastic people who are worth the call. And if you found the show as a one-off, I'd like to remind you to follow and subscribe to Michigan Reimagined on YouTube, Facebook, Apple Podcasts, Google Podcasts, Spotify, iHeartRadio, and pretty much anywhere you find your podcasts. This is Chris Buck signing off for Michigan Reimagined.